So let's get into this case study. We had a client that came in and they complained of elbow pain from rock climbing, which you would think, oh yeah, that's probably going to be a tendonitis. And he also is getting some shoulder pain. No complaints of neck pain at all. And when we went and did our evaluation and kind of tested him, he had pain with a little bit of flexion. He had pain when he's doing anything where he's pulling down because he's really using that bicep. And those were common things that we found. But what we also found was when we tested his strength, because we wanted to see how strong this was and if it would reproduce his pain, we did this, it was super weak. So when we tested his wrist extensors, it was very weak and he had no pain. Now, if he had a tendonitis and we'd be putting stress on the tendon, then that should be painful. So that's kind of one clue that tells us, maybe it's not a tendonitis. The other clue was he had limited, it was like his elbow was blocked and compared to his other side was really soft. If that's really a tendonitis, you're not gonna have that muscle, a tendonitis isn't gonna feel like it's blocked and painful passively. So again, that gives us clues as to going, maybe this is not a tendonitis, maybe it's coming from somewhere else. We also had some shoulder pain, and so we tested his shoulder strength. And so he was strong with going into internal rotation, but external rotation was very weak. No pain, just was very weak. Having a combination of elbow, external rotation, and wrist extension, those are really common inhibition patterns for the neck. So even though he had no neck pain whatsoever, we're thinking we're gonna rule out the neck. I always rule it out just to be on the safe side, but those were clues that gave us that maybe we need to go look into the neck. It wasn't really presenting like a tendonitis. Grip wasn't changing anything. He couldn't recreate his elbow pain. And so those were clues that we've got to look into the neck. Quick pause here. If you're starting to realize your elbow pain might not be an elbow issue, drop a comment below with the word aha, so I know this is clicking for you. Don't worry, we're about to get into even deeper with the tests that help me confirm if the neck is really actually the root cause of the pain. So we had some good baselines with strength testing. Wrist extension, bicep was a little bit weak. We had external rotation that was weak. We had limitations in elbow flexion. So those were all baselines for us. And we had an idea that probably not a tendonitis because we couldn't reproduce the pain with any kind of strengthening thing because your muscle is attached to the tendon. So if you contract the muscle and the tendon is irritated, you should produce pain. It should be very consistent. Was not the case here. So even though this person that we saw had no range of motion issues in the neck, we were going to rule out the neck because it didn't present like a tendonitis. And if anything, we're going to rule out the neck. So what we gave him next was we gave him a neck mobilization. And when we did this mobilization with him, we could tell, whoa, there was actually tightness. So we went and did a retraction. So you bring the chin in. And this is what kind of, you see this in a lot of my videos, but it's kind of like what happens is you're bringing the chin in. So it's like if someone's coming in for a kiss, and you're like, no, everyone does this correctly. So we did this, and then we went straight back. And we did like 8 to 10 of those. Retract, extend. He could feel the tightness. Even though his range wasn't really limited, he had no pain in his neck. He was limited when we did retraction, extension. So after we did about 8 to 10 of those, we went back and tested his strength. Wrist extension, strong. Wrist, shoulder external rotation, strong. 5 out of 5 strength. Before it was like weak, like he couldn't even hold it. Elbow flexion, strong. Now bicep was a little bit tight, but that was coming from something else. And so we just, after doing those baselines and testing his neck, we found out like this, that it wasn't an elbow problem, it was actually a neck problem. So guess what? This rock climber, younger kid, what do you think they're doing all day long? They're on their phones, looking down, those kind of things. They're probably, they might be looking down as they're where their foot is, who knows when they do rock climbing, but the neck was actually causing their elbow pain. Now, most healthcare providers would have gone just to the elbow and they would have done all the soft tissue, they would have braced, and it's very frustrating. So, like I said, 44% of the people actually that have elbow pain, it actually comes from their neck. So you have to rule that piece out. So that's how you'll do it. Take those baselines and go in and do a few retraction extensions, see if your baselines improve. That's how you'll know, like, oh, yep, I've ruled it in, or nope, I've ruled it out. But that's how you will know, and that's the exercise that you will do. So now you know your elbow pain might not be an elbow issue at all. If your symptoms match what we're talking about, then the real solution might be your neck that helps you understand your pain better. So give us 2 thumbs up if this really helps. It really helps others find our video too. And if you want more ways to heal smarter, not harder, hit the subscribe button and turn on your notifications.